Hey guys, this is part 3 of this month's review of mental health and hormones, and I'm discussing your menstrual cycle. You can also review parts 1 and 2 to understand the big 3 hormones, estrogen, progesterone, and testosterone, and the changes of puberty in part 2. You know that your cycle is not just a period. Most of us were taught that our menstrual cycle is a monthly event that produces flow or period, but it's actually 4 distinct phases, each with its own hormonal fingerprint, and each one affects our brain and mood differently. So let me walk you through what I call the hormonal emotional map, right? So in phase 1, this is menstrual cycle. You're actually on your period, days 1 through 5 typically. We have estrogen and progesterone both at their lowest. Many women will feel more inward, tired, emotionally raw during menstruation. This is real and it has psychological basis. If cramps and mood disruption are severe, this warrants a medical conversation. In phase 2, which is the follicular phase, this is days 6 through 13, estrogen starts rising. Remember, I said this is the confidence hormone. So this is often a woman's best week. Energy picks up, sociability increases, creativity flows, confidence is higher. Your brain is literally sharper. Estrogen supports the prefrontal cortex, which handles decision making and emotional regulation. In phase 3, which is ovulation, around day 14, estrogen peaks and there's a brief surge of testosterone. Very brief, but there's a surge of testosterone. Many women report feeling their most confident at this time, social and energetically on around ovulation. This is your natural peak week. And in phase 4, the luteal phase, which is typically days 15 through 28 after ovulation, progesterone rises to prepare the body for a potential pregnancy, but estrogen starts to decline in the second half of this phase. So this is when PMS, or in more severe cases, PMDD, can appear. Symptoms like irritability, anxiety, brain fog, tearfulness, and low motivation in the 7 to 10 days before your period are driven by this hormonal drop, not by you being too emotional. This is why I must explain PMS versus PMDD. So, PMS affects around 75% of women with some degree of premenstrual symptoms. PMDD, or Premenstrual Dysphoric Disorder, is a more severe condition, only affecting about 3 to 8% of women, but it is diagnosable and treatable. If your premenstrual symptoms are interfering with work, relationships, or daily life, that is not normal. It's not something you have to endure. You should talk to a doctor about it. Luckily, in this video, a doctor is providing some tips with regards to managing this. So, I suggest that you try cycle syncing, working with your biology. Track your cycle and your mood for at least 2 to 3 months. Most women are amazed at how predictable the patterns are once they see them on paper. Schedule demanding tasks, big meetings, social events in the follicular and ovulatory phases when possible. Give yourself permission to go slower in the luteal and menstrual phases. Rest is not failure, it's biology. Reduce caffeine and alcohol in your luteal phase. Both worsen anxiety and disrupt the progesterone-related sleep changes. Magnesium glycinate in the luteal phase has solid evidence for reducing PMS mood symptoms. Give it a try to see if it helps you or not. Now let's talk about the birth control pill. Hormonal birth control affects mental health differently for everyone, often reducing PMS-related mood swings for some, while causing anxiety, depression, or irritability in others due to the synthetic hormones. While most users report no significant issues, roughly 43.6% in studies reported mood changes, particularly those with a history of psychiatric illness. There are some key connections to mental health with the pill. Stabilized moods. So some users experience improved mental health well-being because they're on a hormonal contraceptive, since it stabilizes their natural hormonal ups and downs, which can in turn reduce PMS and PMDD symptoms. Depression and anxiety. Some studies indicate an increased risk of depressive symptoms, anxiety, and irritability, particularly during the first 1 to 3 months of use with progestin-only methods. Brain changes. Limited research suggests hormonal birth control may affect areas of the brain involved in emotional regulation. Individual susceptibility needs to be discussed. Those with a history of depression or anxiety are more likely to experience negative mental health side effects. And here's what to watch for. Mood fluctuations, so unexplained sadness, anxiety, anger, or mood swings. Lower libido. A decrease in sexual desire is commonly reported on the pill because it is suppressing ovulation. Brain fog. Difficulty concentrating or mental haze would need to be something of concern in terms of how the pill is affecting you. So the management options would be consulting with a doctor if you have any of the symptoms that you don't like. Switching to a different birth control, a lower dose or a different progesterone, or a non-hormonal method like a copper IUD might help some people. Track your symptoms, monitor your mood, especially in the first few months. See if moods coincide with your cycle or new medication. Nutrient support is important here as well too. Some research suggests potential depletion of nutrients like folate, B12, and magnesium may make side effects of the pill more prominent.